Hello, and thanks for joining us today. Opioid addiction is one of the biggest public health challenges of our time. It's not a crisis limited to one region, one demographic, or one age group. It touches nearly every community in America. Families are losing loved ones, hospitals are stretched thin, and entire communities are struggling to cope with the fallout. Today, we're going to focus on one policy solution with the power to save lives and transform care: expanding access to medicated assisted treatment, or MAT. This is not just another intervention. MAT is considered the gold standard of care for opioid use disorder. In the next few minutes, we will look at expanding why MAT is the right choice, how it benefits both patients and healthcare clinicians, and what makes it a clear priority for advocacy and health policy development. Let's begin with a snapshot close to home. In Arizona, more than 2,600 people died from overdoses last year alone. Nearly 3 out of 4 of those deaths involved opioids. That means that every single day, more than 5 families lose a loved one to overdose. The biggest driver is fentanyl, a synthetic opioid so potent that even a tiny dose can be lethal. In Maricopa County alone, fentanyl is implicated in more than 60% of drug related deaths. Think about what this means for communities: children growing up without parents, grandparents raising children, and emergency rooms constantly responding to overdose crisis. Arizona's overdose death rate, 34.6 per 100,000 people, is higher than the national average, showing that this state is particularly hard hit. These numbers are not just statistics, they are lives lost, and they point to the urgent need for stronger policies that expand access to proven life saving treatments. So, what exactly is MAP? Medication assisted treatment combines FDA medications with behavioral therapies and counseling. The medications reduce cravings and withdrawal symptoms, allowing patients to stabilize physically, while the counseling addresses the behavioral, emotional, and social aspects of recovery. This combination has been shown to lower the risk of relapse dramatically. Patients on MAT are more likely to remain in treatment, return to work or school, and rebuild their lives and families. It's important to emphasize that MAT is not replacing one drug with another. It's replacing chaos and danger with stability and medical supervision. MAT gives people the foundation they need to move forward. Let's talk about why we should be expanding MAT. MAT isn't just effective, it's life saving. Multiple studies have shown that MAT can cut the risk of overdose deaths by more than 50%. Patients who receive MAT are significantly more likely to complete treatment compared to those who rely on behavioral therapy alone. Despite the evidence, access to MAT is still limited. Stigma remains one of the biggest barriers. Too often, people, including some healthcare providers, still view MAT as simply substituting one drug for another. This is a dangerous misconception that prevents patients from getting the care they need. Another barrier is the shortage of trained providers. Not every physician, nurse practitioner, or physician assistant is equipped or willing to prescribe MAT medications. Outdated regulations have restricted access by limiting the number of patients a provider could treat or requiring special waivers. Although some of these barriers are beginning to be addressed, many patients are still left without options. This policy doesn't just help patients, it's also the best choice for healthcare clinicians. Right now, emergency departments often become the safety net for patients in addiction crisis. Many of these same patients return again and again because their underlying disorder has not been addressed. For clinicians, this is disheartening. It creates frustration, compassion fatigue, and burnout. Providers want to help, but without access to effective tools, they are left treating overdoses instead of preventing them. Expanding MAT changes this dynamic. It gives clinicians evidence based options they can trust. It allows them to stabilize patients, refer them to comprehensive care, and see real progress over time. This not only improves the patient outcome, but also restores a sense of purpose and satisfaction for the healthcare workforce. It strengthens interprofessional collaboration across nurses, physicians, counselors, pharmacists, and turns fragmented care into coordinated care. This policy reflects the ethical foundation of healthcare. By expanding medically assisted treatment, we are promoting well being by giving people access to treatment that works. We are preventing harm by reducing the risk of relapse, overdose, and death. We are making care fair by ensuring treatment isn't only for those with financial resources or living in big cities, but available to everyone. And we are respecting patient choice by giving people real options for recovery. In every way, expanding MAT demonstrates what ethical healthcare should look like. Expanding MAT is not just good policy, it's an ethical policy. The strongest selling point for expanding MAT is its proven results. MAT reduces overdose deaths, lowers healthcare costs by cutting down on repeated visits, and decreases incarcerated rates linked to drug use. But it also goes beyond the numbers. It strengthens families by keeping parents alive and present. It strengthens communities by reducing the ripple effects of addiction on housing, employment, and public safety. Every dollar invested in MAT saves multiple dollars in downstream costs. That means policymakers can feel confident that this is both a compassionate choice and a physically responsible one. MAT is rare in public health. It saves lives and it saves money. Another critical selling point is equity. Right now, MAT access is concentrated in urban areas, leaving rural and underserved communities behind. This creates a two-tiered system of care, where some people can access life-saving treatment while others cannot. Expanding MAT closes this gap. It ensures that no matter where someone lives or how much money they make, they can access the care they need. Recovery should not just be a privilege for the wealthy. A future where medication assisted treatment is no longer seen as an optional program or last resort, but as a standard of medical care. Just as we treat diabetes with insulin or heart disease with medications, opioid addiction is treated consistently with effective evidence based therapy. In this vision, patients can walk into their primary care office in Phoenix or a rural clinic in northern Arizona and be offered MAT without barriers. Providers are equipped, confident, and supported to deliver care, and stigma is replaced with understanding. Communities see addiction as a treatable medical condition rather than a moral failing. The impact extends beyond just the clinic walls. Families can stay intact because parents are able to recover and remain present in their children's lives. Emergency departments in hospitals are less overwhelmed. We free up resources for other critical needs, and employers benefit because people are healthy enough to go to work and contribute to society. This vision is not unrealistic. It's what happens when policy, healthcare, and community values align around expanding access to treatments that are proven to saving lives. It's a future where recovery is expected and not exceptional. Getting to that future requires deliberate action. First, we need to train and support more providers. So, MAT is available in every setting from urban hospitals to rural healthcare clinics. Provider training should be paired with mentoring and organizational support to ensure that clinicians feel empowered to prescribe and manage MAP. Second, we have to remove the barriers that still exist. Although some federal restrictions on prescribing have been lifted, challenges remain in licensing, insurance coverage, and pharmacy availability. We also have to address stigma. Public education campaigns, along with leadership from professional organizations, can help shift the perception of MAT so that it's seen as an essential care and not substitution therapy. Third, we have to invest in our rural and underserved communities. Arizona's death rate is above the national average, and a part of this is the lack of local treatment options. Expanding telehealth, mobile treatment programs, and community based MAT clinics are essential steps to make care accessible for everyone. And finally, MAT has to remain a policy priority at every level, so local, state, and national. Policymakers need to continue funding programs, support workforce development, and aligning regulations with what we know works. We have to have advocates, including clinicians, patients, and families. They have to keep this on the agenda and ensure that we're expanding MAT, and not that it's just discussed, but it's acted on. With these steps, we can move forward from crisis response to long term recovery and make MAT a cornerstone of healthier and more equitable future. In the fight against opioids, expanding access to medication assisted treatment is the policy that saves lives, supports clinicians, and strengthens communities. It is the gold standard of care, but too many people are still locked out. By expanding MAT, we take a stand for patients, for providers, and for communities across Arizona and across the nation. This is the moment to move forward from crisis response to sustained recovery. Expanding MAT is how we get there. It's time to make this a priority for health policy and advocacy. Thank you so much for watching.